You have gained notoriety for your skepticism about vaccines. And over the summer in an interview, you said, quote, "There's no vaccine that is, safe and effective." Do you still believe that?
I never said that.
So stop me. We have the clip. Please play the clip.
I just talked about that the media slanders you by calling you an anti-vaxer. And you've said that you're not anti-vaccine, you're pro-safe vaccine. Difficult question. Can you name any vaccines that you think are good?
I think some of the live virus vaccines are probably averting more problems than they're causing. There's no vaccine that is, safe and effective. What I'm saying is that none of the 72 vaccines has ever been tested in a safety study pre-licensing.
So let me ask you.
Fuck out. Let me put the closed captioning on. Sometimes it's hard for me to understand him. I know he has something wrong with his throat. I'm not criticizing him for that. I just can't understand him.
None of the 72 vaccines has ever been tested in a safety study pre-licensing.
So let me ask you if you think it's wise for people to...
But we also, don't see any negative effects that are coming out of vaccines. So, I think at this point, we probably have enough data to show that the vaccines aren't causing autism. I don't think that that's happening. So...
take these vaccines, because you had this to say on a different podcast about whether people with young babies should be getting them shots. Watch.
For many, many years, I think parents were so gaslighted and they were scapegoated and they were vilified and marginalized, so that even parents of kids who were very, very badly injured knew what happened to their kid, but they were just reluctant to talk about it.
Just so you guys know, the vaccine skepticism has always been around. It's been around for a very, very long time. But it really only gained any prominence in the late 90s in England because of one guy who was provably paid to lie about the effects of some vaccines. He said that the vaccines caused stomach irritation, which made their kids autistic. If you think I'm joking, I'm not joking. That's where the vaccines cause autism thing comes from. It causes some sort of irritation in your bowel, and it makes you autistic somehow. And even though that guy was proven beyond a shadow of a doubt with proof that he was paid to lie so that he could sell a different kind of vaccine, people still believe that vaccines cause autism.
Got it. And I think now those days are over. Our job is to resist and to talk about it to everybody. If you're walking down the street, and I do this now myself, which is, I don't want to do, I'm not a busybody. I see somebody on a hiking trail carrying a little baby, and I say to them, better not get them vaccinated. And you hear that from me.
That is insane. Can you imagine you're on, summer break, you're going hiking in on some hiking trail, some national park, some random dude comes up to you with the world's most up voice you've ever heard. Make sure that you don't get them vaccinated. That'll make them autistic. And you're just like, okay, bro. Okay. I'll keep that in mind. Yeah, absolutely.
Hey, if he hears it from 10 other people, maybe he won't do it. Maybe he will save that child.
Maybe he will save that child. You think preventing vaccines for a child will save that child? Do you still say this to parents today?
What I say again is I had 3 vaccines, Casey, when I was a kid, and I was fully compliant. My kids got 72. The current recommendations are, I think, around 77. And
I have a vaccine record for my child, and there are not 77
there are 77 doses. There are 72 doses of 16 vaccines. Oh, that's just a fact.
Oh, man. I have a vaccine record for my child, and there are not 72 vaccines on there. Well, I mean, it's like a couple of vaccines, but they, give them boosters and shit. Okay, so if the first one didn't make him autistic, the third one will? What? Is he gargling rocks? Evidently he has something like up with his vocal cords. You're the perfect master. I know. And you're the perfect pay pig. Give me 10 more euros right now. Okay, did that one guy who was like super ass mad that he wanted me to cover something, did he say what he wanted me to cover? Alan R, bro, the one time I pushed you to look up something, you told me to off yourself or off myself. Has he said anything since? No? I told him to tell me what he wanted me to look up. I'm not scared to look up anything that people want me to look up. Please tell me. Help me. Inform me. Help me. Robert Kennedy Jr. offers to get autism on camera to prove the danger of vaccines. Let's go. 12 pounds. That's right. Let's go. Oh man, I think I have my first unironic pay pig. I don't know how much I can keep that up, but let's see if I can. He said there's 4 rounds of 16. That's only 64 vax. Well, it'd be what? 68 vax, right? But I guess it doesn't really matter. But like, yeah, like the obsession with the vaccine shit is so crazy to me, dude. It's so crazy to me. Like, I never heard anyone get upset about vaccines my entire life until like, I want to say, I feel like the first person I ever saw that was an actual like vaccine skeptic, like not even in real life, because I don't think I've ever met a vaccine skeptic in real life. It was online. I think I was in like early college. It was just like never around my entire life. And then suddenly from like 2015 on, and I don't even necessarily blame Trump for this, right? Just like the degeneration of the collective IQ of our society. But like ever since then, it's just like all over the place, dude. It's all over the place. It's crazy. People can't remember a time when infectious disease was a major killer of children. It's like people thinking they could fight a mountain lion because we don't experience predation anymore. Yeah, that's probably like a huge part of it. I think that a lot of people, I think one of the biggest issues that we don't know how to reconcile with right now is that so many of the issues that we had as like, not just like as a country, but as a species have been not like fully solved, but like the problems have been like mitigated to an unbelievable extent, right? To the point where we don't even realize what we have now and how we got here and why we got here with the technologies and the medical advancements and shit like that. It comes down to not just like medication, but like your trust in news. It comes down to your trust in like politicians or in institutions. I think that because we've had it so good for so long, people are like completely cynical because they don't know what the alternative feels like, you know? And that's incredibly scary because it feels like the obvious answer to like, well, how do we make people understand that something is messed up here? I think that like the obvious answer would be like, well, something bad, really, really bad has to happen to the people who are like so complacent with where we're at in life, you know? But like, I obviously don't want to have to live through that, you know? Accelerationism unlocked. Yeah, I mean, I don't want to live through it, but you know. Yeah, the anti-democrat to anti-government pipeline is real. Why does it keep on opening up on the wrong window? Open up on the window that I want it to open up on. Jesus Christ.
And we need to talk about...
Yeah, the COVID vaccine wasn't a traditional vaccine. It was more of a gene therapy. Experimental, untested. That's why a lot of people didn't trust it. It's not even like gene therapy. That's like a really strange way to like describe it. I understand why people call it that, but that's just like a very strange thing to put on that vaccine. We're not altering our genes in any way. It's just using the cells themselves to not allow the virus to infect it, right? It's just teaching your body how to make antibodies without needing to fight the virus first. Yeah, exactly. Exactly. Me. Holy shit, the lawyer guy is psychic. He knows all. Lysogenic or like means, yeah. I mean, like, I don't know if I could define capsid proteins or lysogenic. Wait, lysogenic. I did know what that meant. Oh yeah, Rob Noor. I had a debate with this guy in, I think, 2021. It might have been early 2022, but I feel like it was late 2021. And he was hardcore on the COVID lab leak theory that the virus leaked out of a lab in China. He didn't say whether they did it intentionally or accidentally, but I guess it doesn't really matter for the argument. And the first conversation we had, I got blown the out. I just didn't know enough of, like, there were so many like intricacies to this conspiracy theory. And I say conspiracy theory because, like, by definition, it was a conspiracy theory. There is a conspiracy to hide the fact that some virus leaked out of China's lab. And, like, ultimately, the real answer is, like, we'll never truly know, right? But based off of what he said on, like, in those conversations, I spent 40 hours over, like, the course of 5 days, like a full work week. This is back when I was a full-time streamer, back when I didn't have any responsibilities. And I spent 40 hours researching and learning how to read scientific journals, learning about the COVID virus, that classification of virus, the SARS virus, the MERS virus, all of these different things. And holy shit, like, it's like, obviously nobody else in the world has enough time, unless you're an unemployed streamer, right, who has a vendetta because he doesn't like the fact he's very competitive and he doesn't like losing a debate. But, like, nobody has time to research these things. But it was very illuminating. It was very illuminating for me to learn how to read these things, to learn how to see when a claim like, oh, well, this gene right here obviously had to be humanly, like, manufactured, right? It had to be done through gain of function research, right? That was, like, the biggest talking point in the entire world. And it turns out that exact protein that they all talked about, the which one was it? It was the furin cleavage site that everyone was talking about. Oh, it had to be man-made. It had to be man-made. Man, if you just, like, obviously not everyone has 40 hours to research into this shit, right? But there are people in the world that do have time to research this shit, right? There are people whose jobs are to, work with viruses. They're called virologists and an epidemiologist. They know about how viruses mutate. They know about how where, like, viruses originate and how they spread and all of this shit. And they have time in their lives, because they get paid to do it, to research it. And then they tell you these things and you just, like, don't believe it. But if you actually learn how to read the studies, if you actually learn how to understand the science behind these things, it's like, oh, holy shit, I could have just, like, cited that one guy who went on to, like, got interviewed on CNN and got interviewed on Fox News and got interviewed, like, this one guy got interviewed on every single news channel. If I just, like, cited him, like, yeah, actually, everything that he's saying is, like, 1 billion% correct. There's like 1-to-1 is what I found out by reading all of these different research documents. I like John Stewart's take on it. The Wuhan novel coronavirus came from an area with a lab called the Wuhan Coronavirus Lab. I mean, like, yeah, but also, like, there's the reason why it was in Wuhan is because that's where the last one popped up. That's where SARS popped up, right? I'm pretty sure, right? Here, I'm a little bit sketched out about, like, YouTube's content moderation stuff. But if I look up Wuhan lab origins, spell that wrong. Just go to their Wikipedia page. Oh, no. Sorry. No, it was opened well before that, but we started, like, helping with the research over there and funding over there because of the SARS virus. That's right. And now you're on a watch list. True. I've been on a watch list for a long time. All right. Socks, please. You don't get socks until I have at least $50 in my bank account by the end of this stream. We're at 30. I'm not even gonna say. I'm not gonna tell you. You have to guess. Let me see here. The best part was realizing how dogshit COVID was. If it was man-made, a pathetic bioweapon at best. True. I heard RFK Jr.'s voice is like that because of a vaccine injury. No. That's not what I heard at all. RFK voice. I'm pretty sure that this was like some sort. I don't think it was a vaccine injury. Chronic neurological voice disorder and focal laryngeal dystonia. Is neurological in origin, but currently the exact cause is not known. Investigation into the specific causes of the disorder is ongoing, and different areas of the brain may be involved. Researchers are looking at the basal ganglia, which helps to regulate movement, the cerebellum, which helps to control balance. Okay, so they don't know where it comes from. Let's see here. The issue that it takes more effort to do the research and be right. These people don't need to put any effort into being wrong. Yeah, I know. And I've realized that over the course of me streaming that at a certain point, there are certain people that I'm just not willing to talk to anymore because they will shit out 15, 16, 20, 25 crazy points that you have to debunk. Otherwise you just lose the debate. And if you if you debunk 5 of them, right, and then you go on to start talking about the other 20 of them, and you start debunking those, then they'll run back to the first 5 that you've debunked, and it's just insane. So there's some people that are just not worth talking to ever again, So we're denying that COVID came from the COVID lab 2 blocks away from where the virus supposedly originated. That's not what I said. The real answer is we'll never actually have a 100% concrete answer whether or not it did leak from it. A base for the 1199. Still not at that sock threshold though. But yeah, well, there is no real way to actually know if it ever leaked. The genetic markers on the virus itself don't point towards any human interference. So that points more towards a natural release. But the best case scenario for a COVID lab leak theory would be this: is that they had found this virus in the bats in Wuhan. Right. And they just had it frozen and it leaked somehow. But there's no evidence of any kind of human markers on the genome, which are always very, very easy to notice. You can see on the genome, natural and unnatural genome structures. So yeah, it's just it's one of those things that at the end of the day, we're never going to know. China is obviously not going to tell us. And it probably makes just as much sense for it to have happened from the wet market where it seems to have originated, where there were the kinds of bats that were carrying this kind of virus that have the closest known relative to COVID-19 in their population. Is just as likely that it came from that as it came from oh shit, what's the name of the pangolins? Come on. These little fellas, it's equally likely that it came from these guys. It's equal, at the end of the day, we just can't know. So why worry about it? What are we gonna do? Invade China and then take all of the research that happened at the Wuhan lab and then release it to the world? What happens if we're wrong, Match pieces of other viruses. This is the evidence. You realize that viruses evolve in the same way we have genome that matches monkeys and we have genome that matches amoeba and shit at some baseline level. Doesn't mean that we were genetically altered to become human, right? So was the so-called vaccine real, or was it gene therapy? I mean, if you want to be super bad faith about it, you can call it gene therapy, but it was real. I mean, I got the vaccine what, 3 times, and like I don't have autism and I don't have myocarditis, so like I'm pretty sure that it is a real thing. I don't know what the question, like, was it real? Like, were there like actual vials of shit being sent around for people to to get injected with? I don't know what the question is. The Anunnaki created the human race as slaves to Egypt clearly shows this true. Okay, I want to get off of the COVID topic though, because it's just like simply not very interesting to me right now. Are you a scientist, or are you just rambling from what you've been seeing on the media? I literally just, I don't want to like repeat the things that I said literally 5 minutes ago. I just went in depth into how I came to this conclusion. It was not just because of the media. I like actually went through and like did like hardcore research and had to learn how to read certain kinds of scientific studies, because there are different words that they use in scientific studies that have different connotations in a study than we have in like common parlance. Like, yeah, I understand that because I came to the same conclusion as the scientists, you would say, oh, you're just listening to the media. But at the end of the day, I spent like 40 hours researching this shit so that I could talk about this on stream. Yeah. Anyways, we're moving off the COVID topic because it's simply not relevant to right now. Who did the studies? This happened 4 years ago. I don't know like the names of the studies off the top of my head. If you want to join the Discord and you really want to press me on it, you can. Like I can like see if I can go back into some old. I'm pretty sure I have a research document somewhere. If you want to like join the Discord and remind me to send it to you, like you're more than welcome to. He's saying you sound just like and have the same arguments as the media. Well, the media isn't always wrong, believe it or not. Wi-Fi tweaking, so have a good one. Catch you later, Joy. Thank you for the super chat earlier. 40 hours is not much. I mean, like, I'm one person, dude. I'm not a scientist. Like, I researched into one hyper-specific topic for 40 hours. That's more than you did, okay? And I don't know what else I could have like researched for that specific topic that I was arguing about to that would ever satisfy you.
And if you look at death,
Yeah. Started to go up
here's
again.
one. Well, right here, the United States is lowest in numerous categories. We're lower than the world.
Lower than
We're
the
lower
world?
than
What does that mean?
Europe.
In
Take a
what?
look.
In what?
Take a look. Right here. Here's case death.
Oh, you're doing death as a proportion of cases. I'm talking about death as a proportion of population. That's where the US is really bad.
Well,
Much worse than South Korea, Germany,
you
etc.
can't do that. You have
Why
to go.
can't I do that?
You have to go by where. Look.
I
here is
forgot
the
about this
United
interview,
States.
dude.
You
This
have to
was
go by the cases.
Why
of
not
death.
as a proportion of
When we have
population?
somebody, what it does is when you have somebody that
Yeah.
has where there's a case.
Oh, okay.
The people that live
Sure.
from
Oh.
those cases.
This interview was rough. This interview was rough. The orange buffoon never lies. That's what 50% of our country just said. They said that, well, I don't care if he lies even. Like, even when, like, his vice presidential candidate comes out and says, yeah, we manufactured this story about people eating cats and dogs. Well, if I have to make up a story so that people pay attention to this problem that I want to point out, then, yeah, I'll make up a fake story. He said that on live television. So I probably need to open up a new note here of things to look into, because I don't know like specifically what RFK wants to do. I know that he said, didn't he say something about getting like defluorinating the water, like, or was that a joke? RFK fluoride water. Okay, yeah, he wants to get rid of fluoride in the water. Jesus Christ. Now you're playing a judge about school grades? What? Microplastics. What? Oh, are you saying microplastics in food. That's something I don't know if RFK can like do anything about. I think that at this point we're I think we're cooked. I think we have the microplastics now, guys. I think we have to accept that. Okay, I think it's time for us to accept that we are going to be filled with microplastics forever. But I don't know. Do we even have enough research into microplastics to know what the effects on our bodies are? I need like more specific claims of what he wants to do, you know? 25% viewers. Oh, they're back. But yeah, like I just like need specific claims when it comes to this, because like if I want to like, again, there are some things that in like our like FDA, there's probably some things that we could tweak. There's probably some things that we could look into that hasn't been looked into before. Like I'm not like principally against it, but like the way that RFK has talked about health shit in the past, especially when he talks about vaccines, when he talks about like the effects that it's having on the body, like despite all contrary evidence, like at a certain point, I like just don't trust anything that he says. But yeah, like I'm more than willing to like look into these things. There might be some things that I agree with. I don't know. The food companies put dangerous, often addictive ingredients in foods. Do you have an example? Are they putting nicotine into my burgers or something? You seem well informed. I try to be. That's the like point of why I started streaming. I try my best not to be ideologically captured, try to be as honest as possible. Let's spray Teflon on everything. But you trust the government to tell you the truth? Here's the thing about like when we talk about the government. We should always like have a healthy skepticism of what the government tells us. That's what we should have, a healthy skepticism of what the government tells us. But unfortunately, the world that we're in right now, we have an unhealthy skepticism. Our skepticism is so unbelievably high for everything that any governmental agency, that any politician, except for Trump, I guess, for some reason, every news agency, every like fact-based finding, thing, like at a certain point, we have to like reel ourselves back and say like, okay, let's have some epistemic humility. Okay. Epistemic meaning like our like understanding of the world, what is and what isn't like real, right? In like the most basic of layman terms. We have to have some humility on what we can and can't know and what we are going to trust and what we're not going to trust. I don't think that like most people right now have a healthy skepticism of anything that comes from institutions, whether they're news organizations or governmental. So yeah, like, will I believe some things that the government tells me? Yeah, because like, how else the fuck am I going to like fact check that? How am I going to fact check that? There's a bunch of disparate entities all over the world, not even in the United States, right? Like news agencies all over the world that have access to look into what our government is doing. We have the FOIA requests. We have all sorts of things that we can do to keep the government in check. And I think at a certain point, we have to understand that these things do work, right? And that not everyone's out to get us, right? Like we're not being gang stalked by the government. We're not being, like hunted down. They don't have a satellite trained on each and every American citizen. At a certain point, we have to like put some trust in someone besides people who are just like obviously using our trust in them to like get ahead in life. Those requests just get redacted documents. That's not true. What are you talking about? You can get a you can request a FOIA request yourself if you have the money to do it. Like there are organizations like libertarian organizations that have gone through and like done FOIA requests for all sorts of things, and they've gotten information out of that, and they're like the public has learned things from those things. I can't think of an example off the top of my head because I don't like obsess over whether the government is lying to me or not. There's 1,000 chemicals in foods right now. I don't think that all food in the United States has the exact same 1,000 chemicals in it. You're gonna have to give me like some specifics that you think are really bad. Sansol, your YouTube chat doesn't know anything past middle school. You're talking into a void. You're right. I need to stop getting one guide. Okay, let's look. Let's watch this. Let's see what they. Doctor warns about RFK Jr. citing measles death in Samoa. What does RFK have to do with Samoa? Does anybody in chat know anything about this before I watch this video? This will be the first I hear about it. I know much more about economics than the average middle schooler, I'm pretty sure. Yeah, that's true. Econoboy is a very smart guy. And if you're in YouTube chat and you guys like economics and you like to be informed on stuff, Econoboy is a, idiot savant on economics. You're watching fake news CNN? Give me something else that you would rather me watch. Is there another source that you want me to watch about, like, RFK talking, doing something in American Samoa? RFK promoted anti-vax stuff to American Samoa, and a bunch of Samoans died as a result. Man, that sucks. Hey, Doghouse Show is here too. How's it going, bro? Independent news? Well, give me a source. Tell me what to look up. Again, here's the thing. For people who are new in my chat, I am totally willing to look into anything that you want me to look into. There is a thing called a Discord. If you click on that link right there, it'll take you to my Discord server. Look at this. Oh my gosh. And if you scroll up, you can see content suggestions. And right here are all these links that people want me to go over on stream. And I go through probably 90% of them. Unless it's like Tim Pool or someone that I just can't stand listening to the sound of their voice. Working and hating it? I'm sorry, brother. William Patty, I'm going to time you out if you say the same thing 40 times in a row. Tell me what you would rather me get the news from on this topic, or shut the f up. I'm doing it, okay? I'm getting one guide.
But the issue here is that a lot of what RFK says does not make sense to the medical community. In the unfounded conspiracy theories, the false claims about science, well,
and we'll speed it up too.
Frankly, all of this.
I do believe that autism does come from vaccines. COVID-19 is targeted to attack Caucasians.
Google, dangerous additives in food USA. But the problem is it says MSG. MSG is not dangerous. It's only if you eat a pound of MSG. If you eat a pound of MSG at one time, your body probably would not like the amount of sodium that you've intaken. Right? So searching that is not going to help me. MSG is in tomatoes. I need something that's way more specific than that. Okay, we're going to go back. I'm going to watch this, okay? Red 40 is one. Red 40 is made of bugs, right? Isn't it made of beetles that are crushed up? Anyways, okay, here's what's going to happen. For the next 3 minutes, I'm going to watch this and I'm going to respond to this, okay? And then I'm going to look at chat. But you guys are distracting the absolute out of me, all right? So, if you really want to get my attention, you can donate, you can super chat, you can become a member. That'll get my attention real quick. But yeah. Really quick, MSG is sea salt harvested off of seaweed. I don't know where it comes from, but I do know that it's a naturally occurring thing that's in lots of different foods. But yeah, also really quick, if you're watching on YouTube, please like the stream. That helps me out quite a bit. All right, I think all you have to do is double tap on the screen and it'll like the stream. That'll bring more people in here, bring more people into the conversation. Thank you very much.
From vaccines. COVID-19 is targeted to attack Caucasians and
oh, this shit was crazy, dude. Hold on. Do y'all remember him saying that the COVID vaccines were targeted against non-Jews or some shit?
All of this.
I do believe that autism does come from vaccines. COVID-19 is targeted to
COVID-19
Caucasians and black people. The people who are most immune are Ashkenazi Jews and Chinese. COVID was...
Ashkenazi Jews and Chinese people are immune from COVID-19, according to our new health minister. Oh my God, our Department of Health, leader, this guy who thinks that COVID-19 targets white people and black people and spares the Chinese specifically and Ashkenazi Jews, not the Sephardic ones, just the Ashkenazi ones for some reason. Jesus Christ.
Clearly a bioweapons problem. Wi-Fi radiation does all kinds of bad things, including causing cancer. Some of these mass shootings that we're seeing in this country may be related to these new class of drugs of SSRIs and benzos.
Now, to be absolutely clear, there's no evidence of any of what he's described, but it's got the medical community worried, perhaps for that very reason. Because if RFK gets confirmed, he will oversee the 13 agencies under the HHS. From the
Really quick, if there's someone that knows about like tech or like video production, why is it that like every single news, like when they post their videos on YouTube, because I don't get to watch them live, obviously, because I don't pay for cable. Who pays for cable? Why does the like topic down here, the Chiron thing here, and the overlay, why is that like vibrate? Why does it vibrate?
Very reason. Because if RFK gets confirmed, he will oversee the 13 agencies under the HHS, from the CDC to the NIH, the FDA, the Centers for Medicare and Medicaid. Now look, you heard a lot about this, but no one person is one-dimensional, and that obviously includes RFK Jr. He's gained a lot of support, frankly, for saying that he wants to cut corporate influence in healthcare, which might explain why vaccine makers are also freaking out. You know, their stocks actually tumbled after the RFK announcement. He also says that he wants to improve our food by getting rid of chemicals and also additives, and he wants to make Americans healthier, he says, by combating chronic disease. The thing is, he's got no experience running a vast government department. But for that matter, neither does Pete Hegseth, or Tulsi Gabbard, or Matt Gaetz. Trump wants all of them, though, to break down the bureaucracy that they're being asked to run.
Tell me about the Samoa thing. I don't care about...
Which gets me to credit Governor of Hawaii, Josh Green. He's also a physician. Also here with us, epidemiologist and director of the Center for Infectious Disease Research and Policy at the University of Minnesota, Michael Osterholm. Thank you all for being here. Let me begin with you, Governor. Governor Green, you have pretty strong feelings about RFK Jr. as HHS Secretary, particularly after an experience you say you had with a measles outbreak. What happened?
Yeah, well, thank you for having me. We had a terrible experience in Samoa. RFK went and rallied that country against vaccinations when there was a measles outbreak. It resulted in the deaths of 83 innocent children. You see pictures of me vaccinating people there. Basically, what he did is he scared that country away from vaccinations. And measles will kill young people. It caused 5,000 additional cases. And I actually was contacted by the Prime Minister of Samoa to come in with a contingent
What is the population American Samoa? 5,000 people were infected. Over 10% of the like population of American Samoa was infected with measles, dude. Holy shit.
Of medical mission workers from my state, from Hawaii, to go and vaccinate people. And we vaccinated 36,997 people to basically stop the measles. But it was too late for 83 children. We went into one village and a child had just died and was still warm. And then we had a funeral service for that child because they died of the measles, and then vaccinated their 7 or 8 other siblings, and then we went to the next village. That's what RFK did. And if he is confirmed as HHS Secretary, what he will do is he will cast doubt on vaccination programs across America. That will mean thousands and then millions of people will consider not getting vaccinated. We will not have herd immunity, and physicians like myself and pediatricians and all sorts of other healthcare providers will see cataclysmic spread.
Something that I'm like super worried about, because I am poor and I don't have I don't have health insurance. I can't afford to like go and get myself boosters before the coming like vaccine apocalypse. I'm like super concerned, and like really not even for myself, because obviously measles is more deadly to children. But like, man, here's a question for the people who are like all on board the RFK train. Okay, here's a question for you guys. What if you're wrong? What if you're wrong? What if it is the case that vaccines are actually very effective at keeping people from getting measles and dying? What if there is like an onslaught of all these diseases that end up killing a bunch of children in our country? Like, will you guys just find someone else to blame? Will you? Because there's a direct correlation with the diseases after Vaccination. Let's see if we can find like a, oh wait, hold on. This is like gross. Oh, gross. I don't want to see like health pictures. That's not what I want. Diseases before and after vaccines. There we go. Ooh, gross. Ugh. I do not like health images like that. Very gross. Okay, let's see here. Jesus Christ, there's serious stupidity in this chat. Welcome to YouTube chat, brother. All right. Welcome to YouTube chat. If you guys want me to like start opening up more than just the short stream, if you guys want the landscape stream too, I have 54 votes on this poll. All right. It's 50-50. It looks like there are people that do want landscape streams. All right. So if you guys want that sort of thing, then sub. All right. First off, if you want to give direct input, here's the Discord right here. Yeah, like, let me know, you know? Yeah, the shorts feed is bringing in probably like the lowest common fucking denominator of people, you know? Tyson or Jake Paul. I hope it's Tyson, but I don't know enough about boxing to know whether or not it's something that is, you know, likely to happen. Open image and new tab. Here's the measles incident rate per 100,000 people. We had lots of measles before. The vaccine was licensed here. This is when we started giving people the measles vaccine, and it went away within, what, 10 years? No, within 4 or 5 years. There was like no more major outbreaks. There's one brick right here. One brick right here that is very, very, very lightly pink in the mid-70s. Other than that, like, we got rid of measles, you know? We got rid of it. You can start a landscape stream right now. At this point, it wouldn't be worth it because I have to end stream in like 30 minutes. But we still got 30 minutes. So, like, yeah, let me see. I asked the question for people that are like all on board the RFK train. If he's wrong, and a bunch of kids start dying because of diseases that were absolutely preventable because of things that we did have in place because of the regulations on healthcare that we had now, what will you say? Will you change your mind? Will you regret anything? RFK committed genocide against Samoans? That's a hell of a statement. It was just like pure brain rot. The brain worm was controlling him at that time, I bet. How long did they develop the vaccine? That's not the question. I asked you guys a question. Before you start asking me questions about the vaccines, I want you to answer my question. If you start seeing a huge uptick in the amount of deaths of children due to absolutely preventable diseases that we haven't had any outbreaks really for because of the herd immunity that we have through the vaccination program, what will that change your view at all? It'll be treated like January 6th. We know it's wrong, but won't say a damn thing. Probably. Oh, they're all of these are measles. Like I've seen some floating around on Twitter that show like multiple diseases and like the date that they were introduced, the vaccines were introduced, and then like the immediate drop off of people getting sick from that disease. But I just don't have access to it right this second. This is the most psychopathic response to what I just asked possible. Politicians are wrong all the time and cost lives. Iraq, remember that place? Libya, Syria. We're talking about something that is like beyond a shadow of a doubt, scientifically proven to stop people from getting measles and shit. We're talking about children who wouldn't have died in Iraq, by the way. Like, we're not sending American children over there with, you know, M16s and telling them to shoot terrorists, okay? We're talking about children in the United States who could have lived, but for, you know, people, you know, giving them vaccines. I want RFK Jr. to fight me in the ring or cage. It has to be a cage match, okay? Otherwise, he'll run. Everything is Iraq, true. But it's public information. Don't watch the mainstream. William Patty, I'm going to for the rest of this video, I'm not going to look at chat for a second, okay? I'm going to give William Patty, I'm calling him out specifically. If you hear a claim in this video, all right, I'm going to go back to where they first start talking about American Samoa, all right? I'm going to put it at 1.5 speed so we don't have to sit there and like suffer through this video for all of time. If you hear anything that they say that is incorrect, you are welcome to tell me an article, a source, and then like copy and paste the title of the article and post it in chat, and I'll read it on stream, and I'll see, wait, was CNN wrong?
RFK went and rallied that country against vaccinations when there was a measles outbreak. It resulted in the deaths of 83 innocent children. You see pictures of me vaccinating people there. Basically, what he did is he scared that country away from vaccinations. And measles will kill young people. It caused 5,000 additional cases. And I actually was contacted by the Prime Minister of Samoa to come in with a contingent of medical mission workers from my state, from Hawaii, to go and vaccinate people. And we vaccinated 36,900.
1 second. The cat's starting to do bad things in the background. I got to let the cat out of the room. 1 sec. All right, let's go.
97 people to basically stop the measles, but it was too late for 83 children. We went into one village and a child had just died and was still warm. And then we had a funeral service for that child because they died of the measles, and then vaccinated their 7 or 8 other siblings. And then we went to the next village. That's what RFK did. And if he is confirmed as HHS secretary, what he will do is he will cast doubt on vaccination programs across America. That will mean thousands and then millions of people will consider not getting vaccinated. We will not have herd immunity, and physicians like myself and pediatricians and all sorts of other healthcare providers will see cataclysmic spread of disease. So he is the worst possible choice for HHS, and I hope that the president will pull his name back.
We'll see what the Senate says. I should say that RFK Jr. governor said that he, quote, had nothing to do with people not vaccinating in Samoa, and he never told people not to vaccinate, unquote. I know that you have a very different experience, but he has denied those allegations. I do want to bring in Michael in this incident.
Well, do we have like a clip of him saying this? Does anybody know? Have they said in this, and I just like missed it, where his involvement was?
Because RFK Jr. has said that no vaccines are safe.
1 second.
Effective. He also
I was about to ignore chat so that I could watch the video, but this is crazy. You can give children many vaccines later in life rather than infancy. They aren't really adding to herd immunity in infancy since, you know, they're babies and don't really go out much. The entire point of vaccinating babies is because the babies are the most susceptible to die to the vaccines, or I'm sorry, die to the vaccines. Oh God, what a horrible misspeak. They're the most likely to die from the viruses the vaccines prevent. Like, you want to give the babies the vaccines because they're the ones that are going to die if they catch the virus. Measles kill at a higher rate the younger you are.
also said that I'm not going to take away anybody's vaccine. Trying to reconcile the two perhaps would be head spinning. But here's what Trump's transition co-chair, Howard Lutnick, says Kennedy really wants.
He wants the data so he can say these things are unsafe. He says, if you give me the data, all I want is the data, and I'll take on the data and show that it's not safe. And then if you pull the product liability, the companies will yank these vaccines right off of the market. Let's give him the data. I think it'd be pretty cool to give him the data. Let's see what he comes up with.
Okay.
I think it's pretty fun.
Pretty fun. Well, people may hear, all right, let me look at the data. Is there any harm in doing that?
Well, first of all, let me just be really clear. The data that he's talking about is unclear to all of us because the data that you need to use to assess the safety of these vaccines actually is already in the public domain. It's not something that you have to request or to take a look at. And this has been one of the problems with Mr. Kennedy's approach to what we call science, in his words, is the fact that he consistently mixes up messages, he mixes up different disease problems, and trying to follow him and understand what he's talking about is often like trying to nail Jello to the wall. And so that's one of the challenges. You can't have that kind of science. You can't agree on Mondays, Wednesdays, and Fridays that gravity works, but on Tuesdays and Thursdays it doesn't. And that's one of the real challenges in trying to direct response back to the kinds of comments he makes.
Saying, let me see the data, does imply that it's not readily accessible, which might surprise a lot of people as you're saying that it's publicly available. Well, Governor, let me go back to you because a fellow governor, Jared Polis, said that he was excited, his words, excited by the pick, and that while he's not into banning vaccines.
It's annoying how fast it is. I was trying to get through it fast because I'm waiting for that one guy to give me anything that they say that is incorrect here. Give me one thing, because he keeps on saying that this is obviously fake news and this is obviously bullshit and all that shit. So I want him to give me like one thing that they're saying that is incorrect so that I can look into it. I'm totally willing to look into something. If someone wants to say this is absolutely wrong, this is completely wrong, I can't believe that you're watching CNN because it's all fake news, then tell me what they're saying is wrong, and I'll go from there. All right.
He actually praised RFK for wanting to take on Big Pharma, for wanting to make food healthier and regulating pesticides. What do you say to those who think RFK Jr. could do some good?
Well, first of all, I was with Jared today throughout the day at the Governors Association meeting. We talked about this. Jared is very worried about what RFK would do over vaccinations. Whether or not RFK gets to do anything else, who knows? But this is a gentleman who has absolutely no training in public health, no experience in public health, nor does he have any experience in biopharmacologic processes either. He is a quack scientist. It is obvious. And Mr. Trump is doing this to be provocative.
God, I was looking at chat to respond in Twitch chat, and now the corner of my eye, because the screen that you guys see is over here for me. I thought he was Sieg Heiling for a second. I was like, there's no way. They had to AI generate that picture. There's no way. Oh my God, that scared the out of me, dude.
And Mr. Trump is doing this to be provocative. Now, tearing down government when children's health is on the line is not okay. I was disappointed in Jared, who I love, who is one of my favorite governors, but it is not okay. It's not okay to do what he did, to cast doubt on processes that are well established in science. It makes parents scared. When parents are scared, they don't take action. If people freeze and we lose 10 or 20% of our vaccination rates, you'll see disease spread widely across America. And remember, you've got a lot of children who are too young to be vaccinated who will be very vulnerable when these diseases spread. You'll see some polio come back. You'll certainly see outbreaks of measles and mumps and chickenpox. All of these things don't just sometimes kill you, they also will cause serious neurologic damage when children are ending up with infections because they couldn't get immunity. So look, there's going to be different opinions. I'm the only physician governor in the country. I actually had to cross paths with RFK. He has now lied about what he did in Samoa, where he discouraged those individuals from getting vaccinated, and it's very dangerous. We've seen a lot of this kind of misinformation from the Trump universe on many levels, but this is our children's health. This is not a political thing. This is not Democrat or Republican. This is your kids. And so when Republicans go to vote, I pray that they will not allow this gentleman to be confirmed.
What you describe is so daunting as a mother and obviously a person in this country thinking about the ramifications and just knowing the vaccination process that you go through with your children to go to school and beyond. It's very
The governor, I think, has done a great job of laying that out.
to encourage them to focus on.
I don't care about the virtue signaling.
Well, first of all, we have to recognize the seriousness of the situation. The governor, I think, has done a great job of laying that out. But let me just add one figure to the mix here. We estimate with some really very detailed studies that in the past 50 years of vaccines being available for young children, we've saved over 124 million lives. That is 6 lives for every minute for the last 50 years. So if I were a senator asking questions, I'd want to know exactly what data are you citing to say these vaccines aren't safe? What data are you citing to imply that it's a health problem that's being caused by things other than vaccines? And I think the challenge we have right now is basically making sure that people don't walk away with what he purports to be facts versus what are the real science facts.
A really important conversation and a really important moment for our nation. Governor Josh Green, Michael Osterholm, thank you both.
All right, we got, what are the two things that I opened up here? Wait, didn't I open up an image from chat? This is the big one. Here, open in new tab. Deaths caused by smallpox is a share of all deaths in London. This is the first vaccine. What was the smallpox vaccine? The first vaccine ever created. First vaccine ever. It was the smallpox vaccine. Polio cases. No vaccine available until 1955. You see that? They start giving people vaccines. Suddenly they don't have fucking polio anymore. Reported cases of measles in the United States. No vaccine available. 1963. Wham. Straight down. From 1989 onwards, a second dose with the measles vaccine was recommended. In the last decade, there were 100 cases per year on average. We also in France don't vaccinate against the smallpox. Well, I don't think that we vaccinate against the smallpox in the United States either because it's a like an eliminated disease. The scary thing there is if any like crazy, tyrant that has access to that virus, or if like some terrorist organization gets access to it and then decides to like release it onto a population, that population is okay. I'm going to go back through chat. All right. I'm not going to be able to go through any more topics today. But in the last part of stream here, I'm going to, because of the increase in viewership on YouTube, I'm going to be taking suggestions from people for what to look into, right? If there are conservatives in chat that think that I'm just like full of shit, I'm 100% willing to look into basically any topic unless it's like flat earth. I don't care about that. It has to be like a relevant topic to today's world, okay? Unfortunately, vaccine skepticism is one of those things. But yeah, I'm taking suggestions for that. Really quick, if you guys like my stream, if you like my content, et cetera, subscribe to the YouTube channel. If you go to YouTube and you type in Sonsol, oh my God, look at that. You can also just click on the nice, pretty picture of me right above. Look, I've never watched a short stream, so I assume that it's like right above chat or some shit. Okay, you can go here and you can hit the subscribe button. Obviously, I can't show you where that is here because I can't subscribe to myself. But yeah, subscribe to the YouTube. There is right here a Discord link. If you guys ever want to post things in my Discord for me to go over on stream. Right here. See, Sond server. You go to content suggestions, post anything right there. More than likely, I'll go over it on stream. All right. I like to get suggestions from people who watch me to see what you guys want me to go over and research into and see if I'm right or wrong on an assumption or a previously held belief. So please prove me wrong. I want to be as correct as possible. I don't want to look like a total idiot on the internet. All of my opinions have come from me at a certain point, changing my opinion because of better evidence provided to me. So